Welcome back. An Ebola case has been reported in the Democratic Republic of Congo 5 months after the latest epidemic there was declared over. A 3-year-old boy was diagnosed, hospitalised and unfortunately died a few days ago. Teams on the ground are working to trace and monitor around 100 contacts and decontaminate health facilities. For more on this, we're joined by WHO Regional Office for Africa Emergency Response Manager, Dr. Fiona Braka. Doctor, thank you very much for speaking to us this Saturday afternoon. Can you tell us, in light of the number of outbreaks in specifically the Democratic Republic of Congo, how concerned is the WHO about this new case?
Thank you for having me. The case in Democratic Republic of Congo is not the first. There have been 12 outbreaks in DRC over the last 4 decades, since the first case was detected in 1976. We have to understand what predisposes to these outbreaks. This virus is naturally found in animals, mostly fruit bats, and these are predominant in the tropical rainforest areas, and they do get into contact with human beings through hunting or ingestion of the animal meat, and so these characteristics and behaviors do predispose to exposure to the virus. We also have then transmission from human to human through contact with body fluids, and that predisposes others to the disease. So it's the behavior, it's the culture that predisposes. So we are not surprised as well that we will continue to see these outbreaks. In addition, this area, DRC has faced several outbreaks, and the virus does persist also in survivors for some time, and so it's not unusual to have sporadic cases after large outbreaks.
What's the long-term strategy to deal with Ebola and to try and treat these isolated breakout cases in such a way as to prevent more significant spread?
It requires a comprehensive set of interventions to address these outbreaks. The community engagement, so that they are aware of how to protect themselves from getting Ebola virus, is extremely important. The appropriate management and care of the cases once they are identified. We now have tools that are available that are being scaled up ever since we had the large outbreak in Western Africa in 2014 to 2016. We have invested a lot in availing the necessary tools. We do have a vaccine that is available for the Zaire strain that is found in DRC. And we also have some therapeutic treatments, though these are not widely used, but they are excellent tools. So community engagement, the use of the available tools, ensuring that health workers also are aware how to prevent spread, so prevention of spread in healthcare settings. All these interventions together ensure that we contain these outbreaks early and prevent further spread.
How can the international community get involved, and what can they do?
Well, we need the government of DRC, and in particular the provincial level in North Kivu, are leading the investigation and response to this outbreak with the support of WHO and other partners on the ground. Given the constraints in the area in terms of the health system infrastructure and access, it's important that the support that we can provide be availed down to the decentralized response at the district level. So we are rallying and trying to coordinate among the partnership to see what support can be provided in terms of technical support, in terms of logistics. There will be need for our supplies to ensure that case management is done adequately, that the appropriate infection prevention and control measures are in place, the supplies to protect those that are caring for the patients, and ensure that vaccination starts as quickly as possible. All this will require support. It is early in the response. We did have this confirmation just last night. So in the coming days, a comprehensive plan would be available to support the local authorities to ensure that we quickly get this outbreak contained.